WalkJoy and Walking Health represent landmark development in restoration of gait and balance, as well as providing important walking diagnostics in all patients. The compact WalkJoy and Walking Health devices are convenient, precise, and easy to use, resulting in a paradigm shift in gait lab analysis and ongoing patient care and monitoring for most of the adult patient population. WalkJoy is the result of years of critical research and analysis by leading experts in medical physiology, kinesiology, and mobility therapies at renowned medical institutions specializing in these fields. Utilizing a combination of accurate, dynamic spatial analysis and precisely timed synthetic secondary heel strike signals, the compact WalkJoy units provide for quick and efficacious restoration of gait and balance in peripheral neuropathy patients. Significant improvements in patients in as few as 20 steps have been repeatedly demonstrated in clinical trials and multiple beta testing sites on a wide variety of patient types. This remarkable gait analysis and restoration science has been brought together in compact, effective, reliable, and easy-to-use products by award-winning experts in medical product and software design and development. And both WalkJoy and Walking Health products are cleared for market by the FDA. Mina Products is a renowned medical product development firm that has provided the production development and prototyping of both WalkJoy and Walking Health products. Babek Kamanian and his staff have been instrumental in the development of the devices, meeting all human factors and rigorous production demands.
Because of our extensive experience in medical product development, we were brought in to take WalkJoy from a concept to a viable medical product with human factors and ease of use in mind. We also designed WalkJoy for ease of manufacturing.
The primary technologies of WalkJoy combine spatial array diagnostics with immediate signal generation via a vibrotactor array in contact with the skin. State-of-the-art product design, prototyping, and production technologies were utilized in the development of WalkJoy and Walking Health devices, and both WalkJoy and Walking Health products are now being readied for delivery. The real-time data gathering and analysis capabilities of WalkJoy and Walking Health devices required innovative software development. Productive Programming, a leading software and apps developer, has worked closely with Mina Products in this process.
Our initial involvement with WalkJoy was to come in and assist them with patient compliance and to help develop their website. We soon discovered that the data that was being captured had far-reaching benefits. It could be used for walking diagnostics as well as patient compliance. That data collected is really the cornerstone of the Walking Health product. Now, the Walking Health product works on both the WalkJoy and the Walking Health unit. It collects the data, stores it, and displays it in a fashion where doctors and patients alike can view this data to monitor their own progress, and the doctor can monitor their progress. One of the beauties of it is, since the data is collected either through an iPhone device or through a PC, the doctor has remote access to that information real time. In developing the software, we consulted with some leaders in the medical field to find out what those pain points were, what those measurement points were that were important, and to come up with ways to demonstrate that data in a meaningful fashion.
Comprehensive patient walking data is gathered in both an infinite number of walking sessions and with precise data as to the number of steps, rise angle, velocity, and stride time variability. And Walking Health's innovative programming allows for any level of healthcare personnel to easily access and use session as well as individual step data in charting patient status and progress. With their breakthrough capabilities in gait restoration and analysis, WalkJoy and Walking Health products are enjoying tremendous interest and early adoption in a wide range of healthcare markets and services.
Our interest with the Walking Health product is to provide the patient with a simple device that they can put on and use and receive feedback to minimize the risk of falling. The Walking Health is a terrific diagnostic tool for both orthopedic patients that have maybe an ankle sprain or post-knee surgery. And we also use it as a diagnostic tool to look at the patient's gait pattern and any abnormalities they present during normal gait.
Clinical trials are being completed at Willamette University, and multiple beta sites are already using WalkJoy and Walking Health products to improve their patients' lives.
We're really excited about being given an opportunity to use WalkJoy. The main reason is we can always tell our clients, you know, you walk so much better with a front-wheeled walker or a four-wheeled walker versus a cane, but we have to sell that based on our subjective data. By being able to use this, we're able to actually test our residents, and we have some objective data that we can show them and say, hey, look, you walked straight with this, you walked better with this one, and they've got something to actually look at instead of just having to believe their therapist. When we initially evaluate a resident, we can get a baseline of where they start at and use that for goals to improve somebody's ability to walk, and we can actually track that through the computer program that we have with WalkJoy.
In our area of our demographics, we have a very well-educated population that as they age, they want to continue to be active. They don't want to accept that they need to sit on the sidelines. And so what attracted us to WalkJoy, especially for the aging population with the peripheral neuropathy, is it works with the body to enhance it so that they can continue to be active, and it from the inside out with the nervous system stimulates it so that they can go ahead and be as active as they need to be and retrain themselves. A lot of these people will just hang up their activity and sit on the sidelines and medicate themselves. We give them an alternative for that. We believe that the population now is more youthful and they want to stay more active. But there's something else that's more important on this. We can't forget that by showing the patient this, by showing them their progress, it then becomes therapeutic. They see that they are making gains, and this is treating the person as a whole and not just treating their stride or their gait pattern.
Medical experts at leading healthcare institutions have reviewed WalkJoy and Walking Health and believe that with their remarkable abilities to restore gait and balance, provide patient diagnostics with objective, precise, and convenient gait analysis, and provide for comprehensive ongoing patient progress, WalkJoy and Walking Health will be essential to improving patient care and healthcare business.